Hi, we have Mr. Omar Moussa with us. Please introduce yourself and the organization that you're representing today.
Hi, all. My name is Dr.Omar Moussa. I have done my PhD research fellowship at Harvard MGH Boston, where I'm in a joint PhD program with Amsterdam UMC, currently trying to bridge it here to my own company called Renova.io.
That sounds like wonderful stuff put together. You're an honoree here again at the Health 2.0 conference being held in Dubai. So, how does it feel? Continuously being recognized for the effort, the hard work, the commitment in your brain. How does it feel?
I feel very humbled. Everything that I've been doing, of course, has been always in line in helping people as much as possible. Where doing a PhD at a place where it's as prestigious as in Harvard has been only one of the few things that lured me and elevated me so much more in being humble. And coming to a place like this where I can actually extend that to help other people is always very great to do. And now that I was invited for moderating the second session after last year's award is something that I truly wasn't expecting, but honestly.
That's wonderful. I mean, if you keep doing extraordinary stuff like you were, this is going to happen. How are you finding the conference so far? How has it been learning, interacting with people, networking? Do you feel like it's fruitful? Is it giving back?
Yes, I think it is. When you put out a lot of great minds like this with different perspectives, you see that a lot of people are doing the same thing, but in their own style and ways, where you can learn so much from the people around you, especially with integrating all the digitization that we have nowadays. It's something that I can truly say has been very learningful.
That sounds wonderful. Now let's talk a little bit about what you do. You specialize about talking about AI and how it impacts the healthcare sector. And you mentioned in your research that AI has actually significantly brought better outcomes, 50% better results. Yes. Talk us a little bit through it. How come?
So everything in this world nowadays revolves around better outcomes, improving them, but also the efficacy of cutting down the time invested in it. And that is something that we also see in my expertise, that is limb salvage, reconstructing an arm or a leg, trying to save it after an accident or oncology surgery or anything in that terms. So what you do is you have the patient, you do the surgery, you have overall healthcare, you have a length of stay, how long they stay in the hospital, and everyone wants the same. They want the best outcome for the patient, but also for the clinic so that we can help as many patients as possible and discharge them as soon as possible without the complications. And this is something that we used to optimize as much as possible, made frameworks, how a center like that could be developing and also conducting their work as cost efficient as possible.
That sounds wonderful. I mean, you've done your thoughtful research. There's a lot of people watching, like leaders, people who are heading clinics, hospitals. How can they stay ahead of time? How would you tell them, people who are leading these spaces right now, how should they incorporate AI?
So the thing is, you mentioned it, it's also going with the digitization, for example, the AI. I think what is happening in this world is that it's so overwhelming, the amount of resources that we have, that it almost feels like impossible to get into because it costs you a lot of time, it's a lot of risk. But honestly, if I can say anything to anyone, it's just as easy as writing an email. If you can write an email, you can do it. All you need, and that is something that MIT just showed, is being a good guidance for the AI. And this is as easy as eating an apple or anything in the world, where if you have the right guidance, which I will also be delivering for a lot of different high achievers, top performers, to be more effective with that time, free their capacity, so having more time for all the other important things in life that unfortunately what we're doing as healthcare providers takes a lot of sacrifice sometimes.
Yeah, that's true actually, whatever you mentioned. Let's say a hospital CEO is watching you right now. What would you tell him right now?
So with the right templates and advice, you can be guided, cutting down your time, improving your results, as long as you know where and when to allocate the right resources. So that is about the variables that we see in a hospital system, but also at home for an individual. How do your systems work? how can we effectively allocate the right AI use, people, the team building, to eventually cut down the time that is put into it, but actually manage to improve and enhance the results, making it more cost effective.
Yeah, that's good advice. You have to hop on the bandwagon now
Yeah.
so you can implement everything. Where can people reach you for collaborations, for advice? Where can they personally get in touch with Dr. Omar?
Yeah. So I just recently launched my website, that is ranova.io.
Congratulations on
Thank
that.
you, appreciate it.
Yeah.
Where it just went live this week, and what I'll be doing there is deliver actually all the products in a way, but also free courses currently for just everyone here attending the Health 2.0. I have a free template for prompts to use.
Amazing.
As easy as copy and paste. So I truly want to give back. And what I know from all the frameworks that I've been establishing, it works for everyone.
Everybody, yep.
So depending on what you're needing at this point, as an individual, as a healthcare leader, but also as an institutionalizing for your own company,
Yep.
you'll find a product there, you'll find courses, but you can also get in touch with me to get whatever you need to be the right guidance and eventually also improve your results.
That's perfect. So if you're an organization, if you're an individual doctor, if you're anybody, there's going to be personalized templates on your new website. That's amazing. Congratulations once again.
Thank you.
I'm sure there's a lot of people that want to be collaborating with you, and thank you so much for your time.
Thank you.
You're doing great stuff. Thank you so much for being here.